Okay, doctor, can you bust some of the myths regarding hair transplants?
So, a right candidate is a person who has actually lost the roots in a particular area of his or her scalp.
Okay, doctor, can you also share with us the other popular treatments related to hair other than hair transplant?
So, इसी तरह हेयर ट्रांसप्लांट का भी इवोल्यूशन हो रहा है, जिसके कारण जो टेक्निक्स हैं वो इतनी रिफाइंड हो गई हैं कि जिसमें डाउन टाइम इज जस्ट 1 day.
So, doctor, a lot of patients feel that it is a very expensive treatment. So, can you divulge the details of the cost of? Welcome to another power-packed episode of Hair Today and Confidence Tomorrow, where we delve into the stories and science of hair transformation and skin transformations. So today we have with ourselves one of the most reputed dermatologists in Delhi, Dr. Navjot Arora, who is the founder of Dermaheal Skin and Hair Clinic, Dwarka. Welcome,
Thank
Dr.
you,
Navjot.
Thank you for having me here, ma'am.
So, Dr. Navjot, we would like to dwell on the booming topic, which is the hair transplant.
Yes, ma'am.
Every other person these days wants to get a hair transplant. So, can you tell us, our audience, as to who is the right candidate and is it really painful? So, can you bust a few of the myths about it?
So, a right candidate is a person who has actually lost the roots in a particular area of his or her scalp, and not just thinning of the hair. The thinning of the hair, people can be dealt with medical treatments and other PRPs and other treatments, but if the roots are actually gone in some particular area of the scalp, mainly the frontal area and the crown area, then they are perfect candidates for hair transplant. Obviously, they should be physically fit, they should be not be having uncontrolled diabetes or hypertension, and they should be having the will to further continue the medical treatment so that the remaining part of their hair can be saved. Not just the hair transplant, but the medical treatment should be also be explained to them so that they can have a long-term result.
And doctor, why is it more popular among men, not as much as in women?
It's just because of the percentage of balding in men is much more than percentage of balding women, because of the male pattern baldness, which is much more common than female pattern hair loss, and more awareness in men as compared to women. And in men, the baldness is generally at an earlier age of onset, like 20s or 30s. While in women, the baldness generally occurs after 50s or 60s, in which they have already, completed their social, social gatherings and all. And though they are not, they can easily hide it with wigs and, different types of camouflage options. But men, if they are not getting married, if they are, in their active career stage, then they obviously need confidence, and definitely hair transplant gives them that needed confidence.
Can we get into the nitty-gritties of this entire procedure, like how painful it is and what is the downtime?
Basically, it's just like this कि जब पहले normal surgeries होती थी, तो डाउन टाइम 7 से 10 दिन का होता था रिकवरी का. फॉर एग्जांपल गॉल ब्लैडर सर्जरी की बात करें,
राइट.
देन लैप्रोस्कोपिक सर्जरीज आई तो पेशेंट 1-2 दिन में डिस्चार्ज हो जाता है, और अब रोबोटिक सर्जरीज आ गई हैं विच इज अ मैटर ऑफ अ डे और 2. सो इसी तरह हेयर ट्रांसप्लांट का भी इवोल्यूशन हो रहा है, जिसके कारण जो टेक्निक्स हैं वो इतनी रिफाइंड हो गई हैं कि जिसमें डाउन टाइम इज जस्ट 1 day. पेशेंट कैन बी पेन फ्री आफ्टर अ डे और 2. Even during the transplant, the pain is initially only for the first 30-40 minutes when जब उसको इंजेक्शन लग रहा होता है एनेस्थीसिया का, एंड वो भी बहुत इतना अनकंफर्टेबल नहीं होता कि कोई उठ के भाग जाए. It is very
manageable,
easy process. The protocols are set. Mostly पेन किलर्स आर नॉट नीडेड इवन आफ्टर अ डे और 2. अगर हम पेशेंट को 5 days की मेडिसिन देते भी हैं तो पेशेंट 3 दिन की पेन किलर वापस ला के दे देता है कि मुझे जरूरत ही नहीं पड़ी. 4th-5th डे से तो पेशेंट अपना जॉब वापस ज्वाइन कर सकता है. 10th-14th डे से वो कैप तक पहन सकता है. So yes, nowadays the downtime has decreased because of the refinement in techniques, because of the protocols which have been set in the past many years. So the pain and the downtime is very, very less as compared to, let's say, 10 years back.
So, but exactly how long it takes for the person to, completely grow those hair?
So, initial 3 months would be not so good for the hair transplant patient, because जो हमने follicles लगाए हैं, पहले उनके roots तो आपके स्कैल्प में इनबिल्ट हो जाएंगे, बट जो फॉलिकल्स के साथ जो हेयर थे वो शेड ऑफ होंगे। थर्ड मंथ से पेशेंट स्टार्ट सीइंग कि जो रूट्स हमने लगाए हैं वहां से फॉलिकल्स ग्रो करना शुरू कर गए हैं। 4 to 6 मंथ्स पे अप्रोक्सीमेटली 30-40% ग्रोथ आ चुकी होती है जो हमने ट्रांसप्लांट किया है, एंड 9 months to 1 year आते देयर इज फुल ग्रोथ। So yes, if you have, let's say, a wedding or a big function coming up and you are planning a hair transplant, then you should plan 1 year advance, in 1 year advance। नहीं कि आप 3 months पहले या 6 months पहले प्लान कर रहे हैं, नहीं तो आपका full result अचीव नहीं होगा and the whole process would be a waste for you। So yes, hair transplant to give you final results would take approximately 10 months to 1 year, but then it would be a what should I say, very rewarding result।
So is it like a permanent thing, or there are still chances of, even after the hair transplant?
For example, a person's scalp, only this much area is lost, and they are getting the transplant in this area.
Right.
But they have the tendency that this whole area can become bald in future if they are not doing medical treatment. Only this area is the permanent zone. So even after the transplant, for the remaining hairs which have not been transplanted, which do not require transplant right now, medical treatment or PRPs or mesotherapies, which are different types of treatment to salvage the existing hairs, need to be continued. So the transplant is not the final step, but the first step which will give you a lot of confidence, which will be a life-changing procedure for you, for your personality. But still, medical treatment needs to be continued to save the existing hair. The transplanted hair will not go anywhere, but your existing hair which were in between the transplanted hair can definitely go as they are going.
Now, talking of the most important thing, the safety of this procedure, because we've heard few stories in the recent past in tier 2 cities, about the disasters happening.
See, sir, if you must have carefully gone through them, the procedures were not done in a proper dermatology or a plastic surgery clinic. The procedures were done in a very unhygienic area. The concerned doctor had just 2 rooms and they were being shared with other procedures. The technicians were using anesthesia at a very high dosage, and the post-op antibiotic care was also not up to the mark. So after all, it's a surgery.
Right.
We need to have some protocols set. We need to have some safety checkpoints. So whenever we take a patient for hair transplant surgery, we just don't look at the scalp. We do some blood tests to check the fitness of the patient, like diabetes, HIV, hepatitis B, hemoglobin should be okay, and we also look at the psychological point of the patient, in which we should not be over anxious. He should not be over demanding that I should be people showing pictures of celebrities that I want this. So we have to first make the patient realistic about the result. Then we have to check about during the procedure also, blood pressure monitoring is required. We have to check the pulse of the patient. We have to keep monitoring we have to keep talking to the patient. The patient is conscious. He's just been he has just been given local anesthesia. So I have never seen a complication in my clinic, in my setup in the last 7 years, but we keep hearing these things and when we delve into the reasons, then most of the time these are the reasons which we have already discussed. So overall, it's a very safe procedure, just like any other local anesthetic procedure.
Okay, doctor, can you bust some of the myths regarding hair transplants?
So the most common myth among patients which come to us is that they think that they will undergo hair transplant जब पूरा बाल्ड हो जाएंगे, अभी क्या कराना है, अभी तो बाल बचे हैं. So if you have grade 7 baldness or a grade 6 baldness, then मतलब आपका ये एरिया पूरा खाली हो गया है, केवल आपका इतना सा एरिया बचा है, तो फिर ट्रांसप्लांट करके बहुत ज़्यादा अच्छा रिजल्ट आने नहीं वाला, क्योंकि आपका डोनर एरिया उतना स्ट्रॉन्ग है नहीं कि हम उसको पूरा ये एरिया भर पाएँ. अगर आप पूरी बियर्ड भी पेशेंट देने को मान जाए तो भी 50% कवरेज ही मिल सकता है, और वो भी थोड़ा सा आर्टिफिशियल लुकिंग हो सकता है. सो ट्रांसप्लांट कराने का जो सही समय है वो ग्रेड 3 ग्रेड 4 जब आपका कुछ पैचेस में हेयर लॉस हुआ हो और कुछ हेयर्स आपके खुद के एग्जिस्टिंग बचे हों, तो बेस्ट पॉसिबल रिजल्ट आता है. दूसरा प्रॉब्लम ये होता है कि पेशेंट्स ट्रांसप्लांट कराते हैं, 4-6 महीना फॉलोअप में रहते हैं, फिर गायब हो जाते हैं, तो उससे उनके जो खुद के बचे हुए हेयर्स थे वो उसकी केयर करना बंद कर देते हैं, और आखिरकार 2-3 साल बाद वो एरिया बाल्ड हो जाता है, ट्रांसप्लांटेड एरिया तो बच जाता है, एंड देन अगेन द सेम प्रॉब्लम कि फिर से ट्रांसप्लांट करो। बार बार ट्रांसप्लांट करने के लिए डोनर एरिया उतना स्ट्रांग बचता नहीं है। सो अगर आपका ट्रांसप्लांट हो भी जाएगा तो भी आपको अपने मेडिकल ट्रीटमेंट या पीआरपी अपने डर्मेटोलॉजिस्ट से पूछ के कंटिन्यू करना है, सो दैट कि आपका ट्रांसप्लांट का रिजल्ट नेचुरली मेंटेन रहे फॉर डिकेड्स टू कम, विच is possible and which we are seeing in day-to-day life. Third problem is कि people are too scared और कि ये तो एक surgery है. So it is definitely a surgery, but a very minor, just a day care surgery done under local anesthesia, very safe if done with proper precautions, and the results are very rewarding and long lasting. So डरने से risk benefit ratio is very good. So the benefit too much outweighs the risk involved.
So doctor, we've seen so many of your success stories on Instagram before and after transformations. Can you share with our audience one interesting story that's very close to your heart?
One interesting story is, that story is like a masala movie story.
Our audience would love that.
The patient wore a patch for his wedding. He didn't tell the in-laws or the to-be wife that I am bald. He got married, and after like 5-7 days of marriage, everyone came to know, and it was a big problem in his village. He told us when he came to us कि पूरा पंचायत बैठा, सब कुछ हुआ, and then he was maybe told to leave the village or something like that. So he came to us कि अब मैं village तभी जाऊंगा जब मेरा proper hairline आ जाएगी, तो इसका कुछ करो. So we all became emotional after hearing his story, and then he had like grade 5, grade 6 baldness. So we had to do 2 sittings of hair transplant. We had to take the hair from his scalp, from the beard, from chest and all, and finally the result was, after 9 months to 1 year, was awesome. And he went to the village, he patched up with the in-laws, he patched up with the wife, and so yes, it was, he even sent us pictures. So yes, that was a very rewarding story.
So it sounds like that story from Bala movie.
Yeah, that's what I'm saying. I was saying the masala movie story, but yes, it's a true one. And these things get you emotionally attached to the people. Yes, definitely.
Okay, doctor, the next thing what I want to know is, why is this hair transplant the booming thing right now?
See, because of you people, you are continuously sharing stories. Your influencers are talking about hair transplant. People like me coming to platforms talking about hair transplants. And second, celebrities are accepting nowadays that they have undergone hair transplants. People like Amitabh Bachchan, Akshay Kumar, Elon Musk, John Travolta. These celebrities have accepted in public that yes, they have undergone hair transplant. So it increases the confidence of the public that yes, the transplant is a procedure which can be done and which should be done for your maintaining your confidence. Nowadays, everyone is posting pictures on Instagram, pictures on Facebook, pictures on social media. Whenever they are going to a vacation, so they don't want to look bald.
Right.
So facial features, hair, everything, people are investing in these things, because just wearing branded clothes and branded wallets and purses is not going to, change your personality. You have to do a permanent thing, and hair transplant is one of them. So these are the reasons the industry is booming, and the problem is that patients are not choosing the right doctors many a times, and that is causing some of the problems in this booming industry.
Okay, doctor, can you also share with us the other popular treatments related to hair other than hair transplant?
So yes, if you have a receding hairline but the roots are still intact, even if they are very thin, then medical treatment itself can give you a really good result in let's say 6 months to 1 year, not in the first 2 months, not in the first 4 months, but 6 months to 1 year. And when added with supplementary treatments like a PRP, in which your own blood's growth factors are used, mesotherapy, in which the growth factors which are manufactured in labs are used, and with different other procedures like exosomes are there. When we combine these things with medical treatment, the results can be worth watching. So medical treatment plus PRP plus in which we do nowadays GFC, which is an advanced form of PRP only, and mesotherapy, when you combine all of them, the results are really nice for those people who still have fine hairs, who still have a good amount of scalp which is still covered with hairs.
So can you also tell us, doctor, the contraindications for hair transplant? Like what kind of patients cannot get it done?
So if you have uncontrolled diabetes, if you have a pre-existing heart condition in which your heart function or ejection fraction is less than 40%, if you have a breathing issues in which you can't lie down for continuously 8 to 10 hours, or you have anxiety problems, or you have some OCD issues in which you are consistently concerned about the results and all, then those patients are not good candidates for hair transplant. Diabetes patients can still be, we have done patients in which we first control their diabetes in the first 3 months by consulting a physician or an endocrinologist, and then we did the transplant, and it was very successful. But for the cardiac patients, we generally don't do hair transplants because we require then a special care, in which the cost goes up like 3 to 4 times. Okay. So then it's a contraindication, especially in a clinical setup.
So is there also an age factor, like how early because sometimes alopecia can even young patients can have it. Yes. So what is there a age bracket?
Basically young age, so after 20 we can do hair transplant in anyone who has clear cut baldness or clear cut receding hairline. Up to 55 overall we are doing hair transplants, but after that we do more testing regarding the overall health of the patient. For example, if a patient is above 55 or 60, then we also do ECG, we do echocardiography to rule out the underlying heart condition which may not be apparently visible to the patient and to the doctor. So yes, as the age increases, the pre-scrutiny increases, but it does not mean that it's a contraindication. We are still doing hair transplants.
So doctor, a lot of patients feel that it is a very expensive treatment. So can you divulge the details of the cost of this?
The cost varies from doctor to doctor, area to area. So obviously if you are going at a very premium center in which there's a lot of show off, so the cost will become high. But on an average in my center, I can say that the minimum costing for a very small area of hair transplant would be like 50,000. And for a large area, it would go from 1 to 1.25 lakhs. That's it. So if the patient still feels that yes, they can't afford it in one go, then we have a no-cost EMI option in our center, in which just like you buy phones and other things online on a no-cost EMI, you can go for hair transplant at a no-cost EMI. We have some like Bajaj Finance does it, and many other companies are doing it.
That's a very interesting option that can be utilized by the patients.
Yes.
So now talking of the post-operative care.
Yes.
What is the exact post-operative care one needs to follow?
Basically, one needs to take a good rest for at least 2 days after hair transplant, in which they need to protect the area from dust, pollution and from direct strong winds. So we generally tell them to stay at home for 2 days. They have to keep using saline sprays, just like a sodium chloride or a normal saline sprays on the transplanted area after every 2 to 3 hours when they are awake, and after every 4 hours at night. They have to the dressing has to be done in the clean after 2 days of the donor area. They have to take antibiotics. 1 or 2 days painkillers are required, not more than that. The antibiotics need to be continued for 5 to 7 days. Generally, after 3rd or 4th day, patients can join their workplace, but with the precaution that they will be wearing a surgical cap, not a normal cap, but a surgical cap to protect the area from dust and from the touch of other people also, and from sometimes the patient doesn't have that awareness and they tend to scratch the area, so the cap prevents these things. And otherwise, after like 7 to 10 days, they can wear normal cap, and let's say around after 14-20 days, everything becomes absolutely normal apart from the transplanted area which is still there, and then after 3 to 4 months the hair starts growing. So main precaution is in the first 2 days or 3 days. Slight precautions are in the next 3 to 4 days. After that, not much precautions are there.
And doctor, can you tell us, these days hair patch is also very popular. So hair patch versus hair transplant. Can you guide our audience?
So many people who are afraid of hair transplants, who are afraid of going any medical treatment, sometimes they become completely bald, like grade 7, grade 6 baldness. For them, I would myself say that they are better candidates for hair patch than hair transplant if they really want to show off their hairs. But for the people who have like grade 3, grade 4, grade 5, in which still the area is salvageable and the transplants are very successful, for them hair patch is ideally not a good option. It looks very artificial. It has to be taken care of repeatedly because there is a glue involved to put the patch there. It can cause scalp irritation, itching also, and the most important thing is unnatural. It does not look, the people know that you are wearing a hair patch even if you are boasting your hairline. And yes, the hair patch is good for those people who, for example, there is a function in the home and they don't have the time for hair transplant. As I've already told that it takes a total of an year to grow back those hairs which you have transplanted. So if you have a function in the home after 3 to 4 months, which is a bigger one, then obviously for that function you have to wear a hair patch, and later you can decide for hair transplant.
Thank you so much, Dr. Navjot, for this honest and insightful facts about hair transplant and other hair treatments. So, if you are looking out for that perfect clinic where you can find treatments related to hair transplant, hair treatments, and dermatological treatments which are conventional plus the skin diseases. So, if you are looking for any kind of dermatological or aesthetic treatments, then you must visit Dermaheal Skin and Hair Clinic, where you will be guided for that perfect hair transplant or any other skin related diseases or the dermatological treatments like Botox, fillers, because they have a team of 3 dermatologists and 15 technicians where you will definitely not be disappointed and you get everything under one roof. If you found this episode useful and insightful, please do subscribe to my channel. Plus, do not forget to like, comment and share it with your friends. Thank you.